Hello everyone, welcome back to part 2 of the cranial fossa video of the head and neck module. This video again serves as a very basic revision, and it is worth mentioning that if you wish to study, please consider studying on your lectures rather than this video. The middle cranial fossa involves two different bones, namely the sphenoid bone, which is highlighted right around here, and the temporal bone, which is highlighted right around here. The boundary and the borders of the middle cranial fossa involves the following. Now here we have the sphenoidal limbus, which separates the anterior and the middle cranial fossa respectively. And we also have the posterior border of the clinoid process, and also right around here we have the dorsum sellae of the sphenoid bone, along with the superior borders of the petrous parts of the temporal bone, separating the posterior margins, separating the middle cranial fossa from the posterior cranial fossa, respectively. It is important to identify that the sphenoid bone, right around the middle cranial fossa, has some very interesting and important anatomies. A lot of medical students can immediately point out the hypophyseal fossa, where the pituitary gland will typically rest. Now, one of the first things that medical students will tend to figure out immediately is the sella turcica, or the hypophyseal fossa, which actually contains the pituitary glands respectively right around here. Now, within the hypophyseal fossa is where we will have the pituitary gland, and also here is the dorsum sellae, which also forms as a boundary. We have the posterior clinoid processes right around here, like the edges of the dorsum sellae, and we also have the anterior clinoid processes around the lesser wings of the sphenoid bone respectively. Now this segment here is known as the sulcus chiasmaticus, or the chiasmaticus sulcus, and these are the optical foramen, or the orbital foramen. The foramen are very important in transmitting the ophthalmic nerve, which is the second cranial nerve, along with the ophthalmic artery and its respective branches. Now, keep in mind that the orbital foramen should not be confused with the superior orbital fissure, which lies right underneath, slightly inferior to the orbital foramen. Now, the superior orbital fissure, which is highlighted with my hands with this fellow tweezer, houses the superior ophthalmic vein. Now, the superior orbital fissure, which I highlight with my hand with the tweezer, with the blue tweezer right now, not this one, the one slightly inferior to it, is where we will find the superior ophthalmic vein, along with the oculomotor nerve, which is cranial nerve number 3, the trochlear nerve, cranial nerve number 4, along with the lacrimal, frontal, and nasociliary branches of the trigeminal nerve, which is very important, cranial nerve number 5, along with the abducent nerve, which is cranial nerve number 6. Now remember, SO4-LR6, superior oblique muscle of the eye, is supported by the trochlear nerve, and the lateral rectus is supplied by the abducent nerve. So this is a very important reminder for all of you. Remember in the first video how I mentioned not to confuse the foramen rotundum with the foramen cecum. This is because the foramen rotundum is located on the sphenoid bone and transmits the maxillary division of the trigeminal nerve. So the superior orbital fissure transmits the ophthalmic branch of the trigeminal nerve, whereas the foramen rotundum, the maxillary branch of the trigeminal nerve, or cranial nerve number 5. Now, one of the most important landmarks we see on the sphenoid bone is actually the foramen ovale, followed by the foramen spinosum. The foramen ovale is like a large oval, with the foramen spinosum being slightly smaller and slightly posterior lateral to the foramen ovale. Now, the foramen ovale transmits the accessory meningeal arteries, which you can see the grooves of the accessory meningeal arteries respectively, and also it transmits the mandibular division of the trigeminal nerve, and sometimes the lesser petrosal nerve. Now, the foramen spinosum transmits the middle meningeal arteries. You can see the grooves for the middle meningeal arteries, whereas the foramen ovale transmits the accessory meningeal arteries. But the foramen spinosum also transmits the meningeal branches of the mandibular division of the trigeminal nerve as well. Now, separating the sphenoid bone from the temporal bone, we have the foramen lacerum. Now, the foramen lacerum is a very, very important foramen because it carries the internal carotid artery. So as you can see, this is the foramen lacerum. It carries the internal carotid artery along with the artery of the pterygoid canal, and also carries the nerves of the pterygoid canals. Now, it is also worth mentioning that the segment of the sphenoid bone that lies inferior to the lesser wing consists of the greater wing of the sphenoid bone, where it contacts with the temporal bone respectively. And also right around here, we can sometimes see the hiatus of the greater petrosal nerves respectively. And like we mentioned, the posterior border of the middle cranial fossa is a part we call the superior border of the petrous parts of the temporal bone respectively. So next video we will be talking about the posterior cranial fossa respectively.